Hey, GLP-1 plus sides community. Before we jump into the podcast, please take the time to leave us a 5-star review on whatever audio platform you're listening to the podcast on. Share your story and how the podcast has helped you. This will help us get referred up in the audio platform so that we can reach more people that need our help, our support, and guidance from our doctors. Help us get loud and change things. Are you interested in understanding GLP-1 medications like Ozempic, wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault. Hey everyone, before we dive in, I really want to share something personal with you. About, I want to say like 8 to 10 months ago, after losing 100 pounds on GLP-1s and keeping it off for a long time, I started regaining out of nowhere, and I was terrified. But I also started having hot flashes and bouts of crying and snacky cravings and waking up at 3 a.m. unable to go back to sleep. It turns out I was in perimenopause. So I started hormone replacement therapy, which is also called HRT, through a telehealth called Winona that specializes in this. And it changed everything. And now I'm sleeping better and my hot flashes are all but gone, thank God. And I feel like myself again. And it turns out that you can actually start perimenopause as early as 35. And well, I'm 46 and she's here. HRT has really come a long way and there's just no need to suffer anymore. So if you're like this and you're in the same boat, you can check out buywinona.com and you can use the link in our link tree to save some money.
Want the fastest working GLP-1? For half the price, Rosen now offers FDA-approved weight loss injections cheaper. With results you can see faster. Lose 15% of your weight with the formula from Eli Lilly that hits not one, but 2 hormones to curb hunger and nausea. Weight loss faster, confidence higher, price cheaper. See if you qualify at ro.co/TV.
Are you ready to transform your approach to weight management? Introducing Mochi Health, a revolutionary telehealth platform connecting you with board-certified doctors and dietitians from the comfort of your home. Their holistic approach includes personalized nutrition plans and FDA-approved GLP-1 medications like Ozempic, delivered right to your door. At Mochi Health, they believe in affordable, accessible care for everyone, regardless of insurance coverage. No more blame or shame, just support from real doctors and dietitians who listen. Visit Join Mochi today to start your journey to a healthier you. Use code PLUSSIDES with a Z to receive $40 off your first consultation. That's joinmochi.com with code PLUSSIDES. Mochi Health, where your well-being comes first. Welcome to the Plus Size Podcast. Hello, ladies. How are you?
Fabulous.
You look sleepy.
Great.
I was sleepy, and then I had Javi Profi, and now I'm bouncing off the wall. Like I was like fangirling over our guest because I like her content so much, and like it's too much coffee too fast.
I think I live on coffee and anxiety, so there's that.
Sure, same. Yeah. Just to knock myself out when I sleep or something. How was spin class, Kat?
Yeah, I just came from a spin class. I'm relaxed. I just inhaled a pork chop and carrots.
Ooh, that sounds good. Have I eaten today? A little. Okay. I know that sounds bad. I had a stomach thing, which the doctor was like, maybe it's the COVID. Do you want to do a COVID test? And I'm like, it's been 5 days. What are you going to do? You know what I mean? I feel fine. I just got a runny nose and I'm getting better. The tummy thing was bad. I even made stories about it, but I don't know. It was weird. But that's why I haven't eaten a lot, because I've been on the brat diet.
Yeah.
So that's what I did. But I ate way more today than usual and seemed to be okay. So #winning. If you haven't noticed, PMAC is with us. So something that Kat and I are doing now is we're the hosts, but we want to make sure that we include the community. So we're going to cycle in different people from the community to be guest hosts with us, to be able to have different perspectives and stuff. So we just think that's important. So we're so glad to have you tonight, PMAC. And Kat, I'm also super glad to have you. So if you guys are new here, a few things. So one, you're going to see me wipe my nose a lot. If you're watching us, I don't know what to do. It's just going to happen. And two, this is the Plus Size Podcast. Where you been? We're so glad you're here. So what we do on this podcast is we focus on people that have metabolic disorders and then all the things to be able to treat that. That could be surgery. That could be therapy. That could be exercise. That could be nutrition. That could be GLP-1 medications. So the whole idea really is to make sure that we're focusing on everything. When we first started this podcast, we were very much just focused on the medicine. But Kat and I have been doing this 2 years now, PMAC well over a year, I think. So I think we've just learned that it was never about weight. It was always about health, right?
Especially
and a lot of people, I feel like, are learning that sooner, like our guest, right? And then which I'm so excited about, because I was clueless. So I'm so excited to be able to, have people on that, understand things a little bit better about sort of the big picture piece, because I do think a lot of times, on this journey, we are so focused on the scale and so focused on the number and so focused on the size of our bodies because we haven't been able to control it. Many of us that have obesity have never been able to control the size of our bodies, right? Or at least not for a very long time.
It's almost like a fantasy sometimes, if you think about it. It was a fantasy.
It was.
To me for a long time.
Yes.
Wow. What would life be like?
Yes. Like you would sit and be like, I wonder what it would be like to be skinny and to be like this. And full stop. And y'all know I'm very open about my jealousy and my issues and stuff and my traumas. But I will tell you, even to this day, when I see people in our community that were my size or started about the same time as me and they've lost an extra 50 pounds or they are in what I perceive to be a skinny body, I feel jealous. I feel like I turn it on myself and I go, what's the matter with me? Right? What am I doing wrong? Right? And the truth is everybody's journey is different. And I know that. So when I have that happen, it's all about turning those emotions around, right? And turning them into something positive, right? And realizing that that's just, it's insane.
Because own it too. Because sometimes I'm like, eh. But now, I am okay being the smallest in the plus size, And if you need me, you can talk to my agent. So that's how famous I am now.
Love it.
But it was great to get there. So I get it. I do.
So I've taken all of the medicines and I do all of the things. And I'm really just now really taking movement as a part of my life, not as a chore or something that I do real quick. I'm doing it as it's just, I don't know how to describe it. It's something that I feel like Kat, and you have to get something. There's a lot of trauma. You got to get to a place. But Kat's always my friend that's been like, I'm going to need you to move now. You know what I mean? But I got so busy with the podcast and with TikTok shop and with content creation and all these different things that I just didn't have the energy or time for it. And now I'm making the time for it. And not because I'm trying to exercise, but because it actually does help my anxiety and my mood and everything. So another piece of this, in my journey, that's just kind of at a different place. And that's what this is about. So, hey, Kat, who are you? Let me shut my stupid mouth.
I'm Kat. I've been on the Terzeps compounds, MJs, you have it, you have it. It's been quite a process. I think it has officially been, we're in September. So it's been 2 years.
Yeah.
Started in 2022. There's been a whole lot of ups and downs, shortages, PAs, more PAs, issues, insurance, shortages. So have I consistently been on an actual GLP-1 for more than maybe 4 months at a time? Not really.
Yeah.
But now I'm there. I've also learned it's a process.
Yes.
Total mind, body, and soul. I thought that I was okay, but no, we had to go back to therapies. It's not a magic bullet.
No,
it's a whole thing. And then that whole perimenopause. Yeah. So
and like our bodies aren't static, right? Like with all the stress I was going through, I had so many stalls, and like there's lots of reasons for that,
I gained.
Yeah.
But now it's going back down again. But
I've gained too. I gained over the past month with all the sadness and all. I had the sads, and then, but I think I'm okay now. But that could also be because I've been on the brat diet. Maybe that's why. Reset. So hey, Mac, what about you? What's your journey like? What you doing?
So abridged version.
Like a version, maybe sometimes it might be a version.
Yeah, it could be. So I've been on a GLP-1 for about a year and 2 months. I've been pure compound throughout the entire time. Lost about 57 pounds, and the world and the economy, I had to come off of it just because I can't afford it right now, but I'm going to be going back on it. The good news is I've been off of it for about 2 months, and really I've only gone up like 2 to 3 pounds, 5 at the most. Great. So I'm maintaining the weight loss. Which one of the things is if anybody's starting this journey is you've got to take the changes that you make and take them seriously, because over the course of time, you've now developed those habits. So if you are in a situation where you do have to go off of it for some reason, you can continue incorporating those changes that you made and not have the fear or the anxiety of, oh my gosh, I'm going to be without my medication for a short amount of time.
Yes.
So
and like ultimately too, like here's the thing, ultimately, these medications are for the few and not for the masses right now. And that's straight trash. And we don't like that. And we want more affordability and accessibility for all that need these medications, because we have obesity, because it is a chronic disease, because we are even now still learning about how these medicines work long-term for this chronic disease. And because they cost so friggin' much, right? And because the issues with the shortages and honestly, like greed, it's always going to be something that we may be off and on. Like that's the thing. Like some of us may go on and then go off like what PMAC did. Some of us may not be able to get insurance to cover anymore and be able to afford it. Maybe compound eventually isn't an option. Like ultimately, we are going to have to stay a community and support each other, because this is not a cure. This is a treatment, right? So I think it's important that we do the best we can with the tool while we have it. And that's what we do on the podcast. So we're so glad to have you here with us. Enough of the me running my mouth. I feel like I ran a lot. Did we not do this in a while or something? God. Oh no. Oh, that's right. I'm on coffee.
You do sound like you are on the job.
It's like I haven't talked about this in a minute. I talk about this all day. It's like, Okay, cool. So let's invite on our guest. So quick background. Our guest is Callie. I'm gonna bring her. I found Callie on TikTok. She's an amazing creator. You would think it's like she knows all the things it took me 2 years to learn. And it's just, she's such a great creator. And I just want her to be able to come on and tell her story. Please follow her, and I will have her come on and share it with us. Okay. Hi, how are you?
Hi.
Welcome to the podcast. How are you?
Thanks for having me.
What does your shirt say? You are, what is it?
It says, you are worth the effort.
Oh, I love it.
Yeah.
I love it. Well,
good reminder.
What we do usually at this point is because in the beginning, when we created the podcast, we wanted people to have a space to be able to tell their story unfiltered, uncut, unlike being on GMA or whatever, where people were getting their bellies blurred out and just very much trivializing the experience that many of us were having, life-changing experience. It's not a diet pill, right? It's just not like, that's what the media thinks, especially those who don't live in big bodies. So we wanted to create a space where we could do that freely and openly and connect with others that also struggle. So Kat and I are interrupters. So we're going to go on mute.
I'm good. You're on Javi. Mute her right now.
She's got some caffeine in her system.
It's a lot of caffeine. It was a mistake. It'll be interesting. It'll have lots of energy in this episode. Okay.
Never a bad thing.
I'm going to be quiet now. You take this space.
Okay. Hi, everybody. My name is Callie Goodwin, and you can find me on social at the Lose It Log. I started my journey back in April of this year, April 2024, on April 1st. And no, it was not a April Fool's Day joke. I have been overweight my entire life. I was in Weight Watchers and personal training classes as young as 5th grade. I was over 300 pounds by the time I was in high school. I have always lived in a fluffy body. My family, my dad's side of the family are all fluffy humans. My mom's side of the family are all extremely tiny humans. I got all of my dad's genes. And so I've lived as a fluffy human my entire life. I have tried to lose the weight years after years after years with no success. Things just weren't working, or I would put in all the effort and not see the results and would give up. And that's like the most discouraging part of losing weight is when you finally get that courage to try and you put in all the effort and it's just not working. It's so disheartening. And so my brother is in medical school and he came to me last September. It's almost been exactly a year. And he's like, Callie, I love you, but you have to work on your weight. And I was like, I don't want to talk to you. Don't talk to me about this. Like he has a small, skinny body. I was like, don't talk to me about this. He's like, no, like I'm in med school. Like the stuff that we're hearing in class, like I am concerned about you. And I was like, you just don't understand. You haven't lived this. And he's like, I want to help you. What can I do to help? And I was like, well, first, stop talking to me. Second, I don't have a doctor. I don't have a primary care physician. I had worked at, so in my day job, I work in social media. Formerly, I've worked at colleges and universities. The last college that I worked at had the Christian healthcare ministries, which doesn't literally cover anything. No prescriptions, no nothing. And so I haven't had a doctor in years. And so it's like, I need to find a doctor. I'm too scared to try again because I don't know where to start. And he's like, if I find you a doctor, will you go? And I said, yes. So he went home and he did some research for our healthcare system. The school that he's with is affiliated with the same healthcare system that I have near my house. He found me a doctor. I went in, filled out a request for an appointment, and then they called me and they're like, hey, cool. It is October 1st. We don't have an appointment till mid-March. And I was like, that's terrible. I was like, there's no other options. They're like, no other options. So I waited. I was like, you know what? That's fine. Like maybe this is the person I'm still supposed to see. I'll just wait it out. No big deal. I'm not going to start a diet right before Christmas and Thanksgiving anyway. Maybe that'll be my New Year's resolution. We'll get till March. So waited till March, went to this first appointment. Actually really didn't enjoy my first appointment with this doctor. I felt like she was very rude that first appointment. I think she was just having an off day because now I love her. But we just had a really tough conversation. And she told me, she's like, Callie, you are at 408 pounds. She's like, you have to lose weight. And I was like, I know, I don't know how. So she actually referred me to the weight loss clinic within the hospital system, which fun fact was a 6-month wait for that too. That I didn't find out for another week or two. She's like, you need to start cooking at home. In my normal life, what is that? In my day-to-day life at that point, I was again working for the colleges. I was working multiple jobs. I was teaching college classes. I'm running my business. I lived off of fast food and convenience food because 1, I didn't know how to cook. 2, didn't have time. 3, I was never home. And so she's like, you have to learn how to cook. You got to stop eating out. You got to drink more water, et cetera, et cetera. I was like, okay, I'm going to work on it. Came home, had a couple of trips the rest of March. And so I was like, I'll start April 1st. Started April 1st, went full force into it, into what I thought I was supposed to be doing. So I was eating salads. I was eating chicken. I am a super picky eater. So it was chicken, broccoli, and salads for like 2-3 weeks straight. And then I went in and realized that I hadn't lost like hardly any weight. I think I'd lost maybe a pound and a half in that time frame. And I was like, what the heck? Like, I am putting in all the work. I'm going on walks every day. I am doing the thing and I'm not seeing any results. And I was like, I know it's only 2 to 3 weeks, but like something has to change here. And so I messaged my doctor. I was like, listen, the weight loss clinic can't see me until, at that point, I think it was like August or something. Like, can we try a GLP-1 medication? Like, can we start this? Like, she wanted to refer me to them to start it. I was like, can you just prescribe this? Like, can we just start this now? And reluctantly, she was like, yeah, well, we'll give it a shot. And she's like, then they can take over your care. I'm so glad we didn't wait, because when I did finally get to that weight loss clinic, which didn't end up being until, I think we got it moved up to like July, I walked in and the doctor walked in, handed me a piece of paper that had been photocopied 9 trillion times. That was for a 1,200 calorie diet, and told me to go to the gym for 90 minutes every day of the week. And that was it. That was the most discouraging appointment, but I am so glad I did not go into that appointment first. Some other stuff happened prior that set me up for success before that appointment, but that just kind of solidified that I really need to kind of take this into my own hands, work directly with my primary care physician, and go from there. And so we did. The next thing I did is I knew that I really wanted to see someone to help me learn about food. I didn't know how to cook. I didn't know like anything about how to work anything in my kitchen. I didn't know like, they say the healthy plate, but like, what does that actually mean? We don't learn nutrition in school. And so what do I need to do? Cause I don't know. Apparently what I'm doing is not working. The 1,200 calories, the salads, the chicken, the broccoli is not working. So what should I do? And so I was talking to my mom about it. And next thing I know, a TikTok ad popped up for a company that connects you with a dietitian. And I was like, cool, let's try that. Typed in my insurance, which is crap insurance. And of course it ended up being covered. And I was like, okay, that's magical. I guess this is what I should do. So I picked the first appointment I could, literally like, I think a day or two later. I was like, I'm not giving myself any time to back out of this. And I had my first appointment with her, and that was the moment that things changed. I told her that I was on a GLP-1 medication. At that point, the food noise had silenced, and that was incredible. I didn't realize how loud my brain was until I realized that part of my brain got quiet. I also have raging ADHD that I am currently not on medication for. I have experienced life when that also gets silenced. And so I was like, oh, there is more noise here. And so that was cool to like be able to silence that enough to be able to work on identifying like what is my relationship with food? What does this look like? Where do I go from here? And so I started working with her. We started meeting once a week. It was over Zoom. So it worked perfect with my schedule. And she slowly taught me about macros, and she taught me about how food impacts our body. And she took into consideration that I was on a GLP-1 medication, and we kind of worked through things. And that was between getting on a GLP-1 medication. I'm on Mounjaro. Between getting on Mounjaro and meeting with a dietitian, those are the two like game-changing moments of my health journey. Because without either one of those, I would have quit months ago. So here we are, almost 6 months. And I just hit 50 pounds down today, which I have never been able to lose more than about 10 pounds in my entire life. And so I started sharing my journey on TikTok. I had a TikTok for my small business that had too many followers for me to comfortably share about my health journey there. My business page has about 114,000 followers, and it has a lot of eyeballs from like news and media, because I do a lot of like advocacy work with some other stuff. And so I didn't want to share my health journey there. So I created a separate one and didn't tell anybody about it. The goal was that it was a place that I could vlog my journey for my own accountability, but like the people in my life didn't have to see it until a few weeks later when they all found it. And like, so did half the world, it felt like. My TikTok is now up to, I think we're at 83,000 followers, and my Instagram's at 35,000 followers. And I've built this incredible community of people that have come alongside me to support and cheer me on. It's a lot of people that are also on health journeys, and being able to share my authentic journey of what I'm going through. It is truly authentic. It is pure chaos. Like, if you've ever watched any of my cooking lives, I meal prep live on Sunday nights at 7:30 Eastern on TikTok. And it is 4 hours of pure chaos. Should it take 4 hours to meal prep? Absolutely not. Absolutely not. But it does, because we talk forever about all the different things and go on so many tangents. And it's been so cool to be able to connect with people in that way. I think this last week we had 33,000 people log in at some point during that live, which is absurd, because that probably was the most chaotic live I've ever done, as we meal prepped some very random items because I did not come with a plan. But I think that's like a big synopsis of my journey. It's been fun to be able to share it online. I've gotten so much more comfortable in sharing my story and acknowledging like where I was, where I'm going. My goal is, I never tell people that I have a certain goal weight. My goal is to get healthy. And for me, I know that is, I need to lose about 200 pounds. And so in my head, my goal is to lose 209 pounds because I want to be under 200. Anything under that, like I just want to find what's healthy for me and my body. But I know that we're not healthy now. We're getting there. We're 50 pounds down. We're a quarter of the way there. In about 5.5 months. And I'm looking forward to continuing the journey and seeing where it takes me. But yeah.
Awesome. I wanted to know, I remember you were making, you made a TikTok recently about another like diagnosis or ailment that's kind of rare that you had. And I just was wondering if you would mind sharing. You would be surprised how many people listen and they're go, oh my God, I got that too, and relatability is so important on this channel.
Absolutely. So I was recently, in the last couple of years, diagnosed with Derkham's disease, and that has been a whole situation. I first started having symptoms in 2015. I was having severe abdomen pain. It wasn't my ovaries. I have PCOS. I've had ruptured ovarian cyst. It was not that. It was like under my skin, but it felt like stabbing. I had x-rays, MRIs, CAT scan, ultrasound, colonoscopy, endoscopy, literally anything and everything they could do, we did. I saw 7 different doctors. And by the time I got to the end, the last doctor told me, he's like, honestly, Callie, I think you need to go see a therapist or a psychiatrist, because I think this is in your head. Like, I think you're just wanting attention. There's nothing wrong with you. And I was like, I swear it feels like somebody is stabbing me in my side, and it's on my left side. And there's no organs there. Like if it was on the right side, they could be like, oh, it could be your, what is over there? Your appendix, stuff like that. It's not over there. It's on my left side. There's nothing there. And so I finally found a doctor that was willing to do exploratory surgery because I was just sobbing all the time. I was also terrified that maybe there was something wrong in my brain that was sending like false pain signals. And then it became like a psychological thing that like I was spiraling. And so I found this doctor, he did exploratory surgery. I woke up from surgery and I asked them, I was like, did you find something? And they're like, oh yeah, they took him out. And I'm like, wait, what? Started sobbing. They had to calm me down because I was hysterical. And they took out a lipoma the size of a baseball out of my left side of my body that nobody had caught on any of the scans. And so lipomas are just like fatty, like encapsulated balls, as much as I understand. They should not cause pain. They should not cause issues, but with Derkham's disease, they do. So doctors like, oh my gosh, there was stuff here. We don't know what it is. It's just a lipoma. Move on with life. That immediately cured the pain for about 1.5 years until it came back. And it actually came back in like a little bit bigger and like more area. And so went back to that doctor and was like, hey, can you do surgery? He's like, no, you're too big. I don't feel comfortable doing this surgery. Like we were kind of at the wit's end previously. He's like, I don't feel comfortable doing surgery on you anymore. And so I was like, okay, well, I got to find somebody because again, like stabbing pain, like I can't live like this all the time. Found a new doctor. He did surgery. Again, at this point, we didn't know it was Derkham's disease. We were just trying to figure out like, why the heck is this lipoma causing pain? Like it shouldn't cause pain. Did surgery, met with another doctor, and I scoured the internet for anything I could come up with. And so I found all this research on Derkham's disease and that, what little research there is. I found a Facebook group that when I read it, I was like, that is what I have. And like, I know, like you have your Google doctors that like patients take stuff in. They're like, I think I have this, and are like crying wolf or sometimes like outlandish claims. And I was like, like, please just listen to me. Like, I think this is it. And she took 1 minute to read it. And she's like, you found it. Like, you found the needle in the haystack. And so there is currently no treatment or cure for Derkham's disease. There's actually very little doctors that are studying it. Most doctors have never heard of it. And so the treatment plan right now is that I just have to do surgery every couple of years to remove these lipomas. So I've had 3 surgeries so far. My last one, they took out 7 because, fun fact, when you take them out, they grow back multiplied, because if it wasn't bad enough that there's no medicines or like no treatment or cure for it, they come back multiplied. So that's fun. I was actually, the insurance plan that I got this year, I got a plan that would cover surgery because I thought I was going to need surgery this year. And I've noticed that in the past 6 months, I have not had as many flares as I was having prior to getting on the GLP-1 medication. And so I'm not saying that is helping it, but it's also, I'm not also saying that it's not helping it. I think that there's something there between the weight loss and the medicine. Like, something has changed in the last few months, and I am not actively seeking a referral for surgery at the moment when I was getting close to that 6 months ago. And so that's encouraging. But yeah, it's super rare. A lot of doctors don't know about
it. Autoimmune disease?
It's in the same like general family of like lipedema. And I haven't really like looked at the newest research and to see what else has come up in the last. I had surgery in 2022 was my last surgery. So we were coming up on that like 2-year mark, and it's like, oh, it's time for another surgery. But I would rather.
Many people in our community that have autoimmune diseases have said they've had less flare-ups.
Yeah. I don't. It probably could be. Again, I haven't looked a ton into the research and like what they're now classifying it as, but it is. They definitely haven't had as many flares as usual. And like flares usually just feel like stabbing pain in my abdomen because that's where they're located. People can get them on their arms, their legs, their back, they're anywhere on their body.
And it's under the skin, sounds like, for everybody. I know I've seen people that have lipomas, I'm saying it right? Like on their body, like on the outside, and they can see it and remove it. But this is under your skin, right? So
it's under your skin. I can literally pinch my skin and feel them. I mean, there's not one on my arm, but like I can pinch my stomach. I can fully feel it. And so when I go in for surgery, my doctor is like, okay, where are they at? And he takes an expo. I pinch it. He draws a circle and then he goes in and removes them like that. They're not super deep, but they are deep enough that they do require like going under for surgery. But I think we took out 7 this last time. Some of them were golf ball sized. We've had one. The first one was the size of a baseball. Like, we try to get them before they get too big, because at that point, like, I was in pain for a very, very long time.
Of course,
But it's not fun, but it has been cool to be able to connect with other people and like realize, wow, we both have this. Like, we both can understand it a little bit more. And also, when you're experiencing a pain where your doctors literally can't diagnose you and like there's no help for it. They just like, we tried. I think I tried probably 30 different medications in the first between the first 2 surgeries to try to like help it. And like, it didn't respond to anything.
Wow.
And so,
we've had people come on the show before and talk about even like fibroids, like either being, I don't know about shrinking like urine, because we can't be careful with like claims and stuff, but like being smaller or less flares up or less pain, like, because like the inflammation reduction, all those different things. So like, I hope that they do more studies on those things, because it would be really great to get more indications for treatments for people. Because like, if you could go 5 years in between surgeries, like, wouldn't that be worth it?
Yeah. I know people always tell me, they're like, so how are you going to feel about like loose skin? And I'm like, listen, I've got like 15 different incisions down my stomach because of stuff. Like, I'm not worried about the loose skin at this point. I am realizing though, like, as I start to lose weight and as like my stomach starts to shrink a little bit, I'm also starting to feel more that I think were kind of buried in there that I didn't necessarily like feel. They're not causing pain, but I'm like, that's not normal fat. Like that is another lipoma. So it'll be interesting to see, like, as I continually lose weight, what happens. But
Awesome. Quick pause here. I've had moments on my GLP-1 journey where insurance changes or rising costs force me to look for a new provider. And honestly, that process can feel very overwhelming. But that's why the Plus Size podcast is partnered with GLP Winner to give our subscribers a resource to help them make that decision easier. GLP Winner is a comparison platform that lets you explore telehealth providers in all 50 states, whether you're looking for brand name medications or compounded options. You can see pricing up front, read reviews, and get a clear picture of which provider might align best with your needs. Check it out today at glpwinner.com/plus-sides. That's glpwinner.com/plus-sides. Don't forget the Z. Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m., and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again. And the hot flashes are gone, which is, geez, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through this same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you have this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need.
"20 seconds a week to lose 20% of your weight in a year with diet and exercise. That's the power of GLP-1s through Ro. Ro helps find the medication that's right for you, based on cost, availability, and your weight loss goals. Losing weight with GLP-1s is possible through Ro.
Well, awesome. Thank you so much for sharing. And I will put this information in the shows because one day, who knows when someone's going to be searching about this disease, just when they're going to find this. Hopefully, if we do our SEO right. And we're not really sure. Kat took some classes. She seems to be figuring it out. But thank you so much. If it's okay, we're going to have Dr. Rosen come on. So Dr. Rosen's bariatric surgeon, and he's been on the show several times. And if you would like to stay with us and be a part of that conversation, we would love that.
Yeah, sounds great.
Great. Thank you so much.
Well,
hello, Dr. Rosen.
Oh my God. Guess who's back?
Guess
back
who's
again.
Back again. Exactly.
That's right. He's back.
I know. You've been a busy bee. I think we went a whole season without you.
Yeah.
Sad.
I went underground. It's that TikTok ban just pushed me underground. I can't believe what I just learned. I can't believe what I just learned from Callie. That's so valuable. I never heard of Durkheim's disease as a surgeon, and I take out tons of lipomas, so that was very interesting. I'll comment on a couple of things that just jumped to mind right away. First of all, I don't think it's the anti-inflammatory process, the autoimmune thing. I think that lipomas, when they are growing, you can get pain sometimes from the capsular spread, the strain on the capsule that is holding in that fatty mass. And so our body can feel a stretching pain quite sharply. And so that might be one of the things. And there might also be some skin nerves in the vicinity that are being compressed. And what I would surmise, the reason you're seeing less experience on GLP-1 is for these things to grow, right? You have to have a calorie excess because you're depositing fat. Like the fat cells can't stretch full of lipids, basically, which is what fat cells store. They store lipids as a bank in your body. And so you need to have a calorie excess in order for there to be lipid to deposit in those lipomas and have them grow. So I would suspect being in a calorie deficit as a result of being on GLP-1 medications, those lipomas aren't growing or are growing as rapidly. So you're seeing a delay in the symptoms that would necessitate surgery. That's how I would put that together. But very interesting. And I'm glad that you finally found a surgeon who would validate your symptoms instead of dismissing them and who would help you manage the condition. So kudos to you, like, for figuring it out.
Thank
Honorary
you so much.
doctorate degree.
Thanks. No, my brother's the one in med school. But yes,
Look out.
I'm just glad that we were able to find something, and obviously to be able to share more awareness about this, because I know a lot of people that hear my story, they're like, oh my gosh, I have similar symptoms. Like, I'm going to go ask my doctor about this. And I was like, well, make sure you send them a MyChart message or whatever before you go, and ask them if they can look this up prior to you getting there, so that you're not just like walking in and stunning them with some information. Like, let them have time to be able to do a little bit of research to see if that does match with what you're experiencing. But yeah,
I actually think that's really good. Like, that's something that the doctors have told us on the show, is that, hey, like, people say all the time, how do I talk to my doctor about GLP-1s? Right. Because they're very much focused on the weight, because we know the weight is an issue. Right. And the doctors have told us, like, if you're going to go to your primary care, send them a message beforehand and say, I want to talk about weight. Here are the medicines that are covered. This is what I want to talk about. Right. So that they can prepare, instead of being like, oh, you know, especially
if they're like primary care docs who are still stuck in this mindset of afraid to discuss weight. Well, they'll talk to you about everything except your weight. And then at the end, they'll throw it on you like a pile on, like, oh, by the way, you need to go home and lose some weight. Like, no, like, I need to get some weight off of you. Yeah. That's the way the doctor needs to think.
Yes. Mm-hmm. I love that. Ooh, that's a short. Right there. So, Dr. Rosen, I didn't even do our intro. So I said, hey, this is Dr. Rosen, blah, blah, blah. But some people don't know. So, like, here's something we kind of talked about when you first got here in the beginning, in our pre-show, which I should start recording, because we get good stuff there. But we were talking about how people get on this journey, and they, in my experience, right, they very quickly, when that noise goes away, and that, like, immediately they're like, holy shit, I have to know everything. Right. Yeah. And they need as much information as possible. Right. And so they, for like 6 months to a year, like, just are trying to get as much knowledge as possible, because there's some sort of solution to something that has plagued them either for their whole life or a very, very long time. So what happens is we just kind of keep replenishing people that come to the podcast. So we get messages from new people and people midway through. We have loyal people that'll always come, you know what I mean? That they just love what we're doing and love being a part of the movement and contributing and all those things. But we're always getting new people. So I would love, even though you've been on the show so many times, I would love if you could kind of tell us a little bit about who you are and how you help people.
Sure, absolutely. So my name is Dr. Daniel Rosen. I'm on socials as Dr. Daniel Rosen. That's Dr. Daniel Rosen. And I am a bariatric surgeon, as well as a board certified specialist in obesity medicine. And my practice surgically used to be 70, 80% bariatric surgery. And what I found was that a lot of people who had obesity also tend to develop hernias in their belly button, hernias in their groins, hernias in their diaphragm, where their stomach starts to push up into their chest, because there's so much intra-abdominal pressure. As their abdomen expands, the muscles are holding things in, and the pressure is looking for somewhere to escape. So I do a lot of hernias, and then GLP-1s came along and, like, rocked my world. Like, oh my God. It was so hard to convince people to get surgery, because this miracle cure came out. And so you can either fight it or you could join it. So I decided to join it, and, you know, got trained in these GLP-1 medications and other weight loss medications. And it's been a major part of my practice, and also a major passion of mine in terms of advocating for people with obesity, educating people with obesity, and getting the word out on social media. So that's kind of how I came into this and how I got a chance to meet you lovely ladies.
Love it. Love it. There's a couple things that I feel like from one of the episodes, it's one of our top performing episodes. If you haven't seen it, season 1, episode 5, it's called Fat and Lazy. And we named it that. We talked about it at the time for the title, that I was saying, guys, legitimately, I am telling you, 2 years into this journey, there is no such thing as fat and lazy. Okay. Case in point. First of all, I don't like that thing, but I did it on purpose to incite, right? Callie has a bazillion businesses and a bazillion accounts and a day job, and she struggles with obesity. Okay.
Yeah.
You start curing people with obesity, or you start treating their actual disease, right? Their biological dysfunction. They are boss. They always were. They were just sick people that need medicine. And I will go to my grave saying that. Like, at the end of the day, there's no such thing. So there's a short, but right there.
who were
Preach
they
it.
were misjudged.
Yes.
Misjudged
100%.
by people with skinny privilege.
Yes.
And when I say skinny privilege, I mean that they didn't have to fight to lose weight. So when you don't have to fight to lose weight, you think other people don't have to fight to lose weight. And the only reason they're not losing weight is because they're not putting in any effort at all, which is a complete misread and such a narrow view of the world, where you think everyone experiences things the way you experience things.
Yes.
It's just wrong. So I've always said that the majority of obese people probably eat cleaner than I do, because they've had to, just in order to slow their weight gain, because they have so much genetic predisposition to gaining weight, and because their bodies are programmed evolutionarily to retain calories in a much stronger way than someone who doesn't deal with obesity is programmed.
Yeah. We talked about, and I will tell you, in my journey, episode 5 for me was a big one, because you're a surgeon and because I've had lap band surgery. Right. And we were talking about how mine had failed, and how once I had gotten pregnant and gotten it out, I gained the weight back. I couldn't get it off. And honestly, a lot of it was because I was honest with you. I have BED. I've had BED my whole, as long as I can remember. And I specifically told you about it on the show. And you said you didn't have the tools, Kim.
Right.
And I was just like, don't cry. You know what I mean? And that's true, because it's all about the next tool to be able to help with the chronic disease. Right. And I remember telling you, I used to tell myself the negative talk. You are so pathetic. You have all these privileges so many people don't have. You've had surgery. You've had this. You're so pathetic. Right? Because you just continue to eat smushy food and drink when you eat and all these things. You're so pathetic. And then what you told me was, that's actually just your brain, Kim, because you have obesity, right? Nothing changed for you. The lap band just did a restriction. It was just trying to do behavior change for you, but you have a disease and nobody freaking told you that. You know what I mean? And that was a big deal to me. And I remember on that episode, if people haven't seen it, let's look through it again. You were telling us kind of how GLP-1s came about. And a lot of it has to do with bariatric surgery.
It does.
Yeah. Kind of explain how that came to be.
It was
sure.
It was awesome. It's mind blowing when you told us.
We originated this stuff, people. What was so interesting is, as I was training, I was working with some big time people who were pioneers in the field. And I was a student, and I was writing papers and reading papers. When you write a paper, you're citing 40 papers. So you're reading all these papers and you're synthesizing all this stuff. It's amazing. And so it was pretty interesting to see how we knew about this hormone GLP-1 even back then. And how was it identified? So there were people who were getting gastric bypass surgery specifically, because this was early in the days after lap band had been released. And the majority of the surgeries that were done were gastric bypass, both through open large incisions and through small laparoscopic access. And what they found was that diabetics who had bariatric surgery, who were obese, 80, 100, 150 pounds overweight, they would be able to come off their insulin before they even left the hospital, meaning before they lost any weight. So you couldn't say that the diabetes was directly related to their weight, because they would be off their medication before they'd lost any significant amount of weight. And some people would argue, well, it's because they were on a liquid diet. And so some people started to do studies, and they would provide nutrition to people of the same sugar content at different parts of their GI tract. So they would put a feeding tube down, and they would release protein shakes into the gut at the beginning of the gut, at the middle of the gut, and towards the end of the gut. And what they found was that people who had the protein shakes released towards the end of their gut had this massive spike of a hormone that was identified as GLP-1. And what that hormone did was it lowered the blood sugar by promoting the release of insulin. it also worked in the brain and caused a massive decrease in hunger, an increase in fullness or satiety. And that's what you were seeing in bariatric surgery, because with gastric bypass, you reroute the intestine. And when you reroute the intestine, you take the bottom half of the intestine and you plug it straight into the stomach. So the food goes from this like smaller stapled stomach straight into the middle or second part of the intestine, which usually doesn't see a lot of food, especially if you're obese, because obese people are so adapted for calorie extraction that food doesn't make it to the end of their intestines often. And when food doesn't make it to the end of their intestines often, then they don't have the stimulation of those cells at the end of the intestine, your hindgut cells called L cells that release GLP-1. So you're never full because the GLP-1 is not getting stimulated, because your intestines are so good at breaking down that food and absorbing that food so that it's all gone by the time it's getting to the bottom third of your intestine. Now, since you're plugging it into the top, these cells are seeing proteins, fats for the very first time, and you're having this massive surge in GLP-1, priming the pancreas, releasing insulin, and the diabetes went away. And so that was one of the major discoveries. And of course, the drug companies right away lined up, how do we start producing these GLP-1 analog medications in order to provide the benefit without the need of surgically rerouting the intestine?
I have a question for you on that one then. Made me think, is this why like maybe lap-band was not as successful, because you're bypassing the...
You're not bypassing anything.
Are you ready to transform your approach to weight management? Introducing Mochi Health, a revolutionary telehealth platform connecting you with board-certified doctors and dietitians from the comfort of your home. Their holistic approach includes personalized nutrition plans and FDA-approved GLP-1 medications like Ozempic, delivered right to your door. At Mochi Health, they believe in affordable, accessible care for everyone, regardless of insurance coverage. No more blame or shame, just support from real doctors and dietitians who listen. Visit Join Mochi today to start your journey to a healthier you. Use code PLUSSIDES with a Z to receive $40 off your first consultation. That's joinmochi.com with code PLUSSIDES. Mochi Health, where your well-being comes first.
Yeah, that's what, I mean.
In fact, you're slowing the food. Like the food will stay up at the top of the stomach. So you have a mechanical stretch in your esophagus that makes it uncomfortable for you. But your brain is still waiting for the food. Your stomach's still saying like, fill me up. So your ghrelin, which is this hunger hormone in your stomach, you have the ghrelin at the stomach and you have the GLP-1 from the end of the intestines. Your ghrelin is staying high because the food's stuck on top of the band and not getting into the stomach to sort of lower the ghrelin from the stretch of your stomach being filled up. And that food isn't making its way down any better because your intestines are still awesome at absorbing, but you're absorbing even less food because you can't force enough down. And so you don't get a GLP-1 spike. So that's why the lap band ended up being the worst of the bariatric surgeries. With a sleeve, at least you have a big drop in ghrelin, because the part of the stomach that makes ghrelin, a lot of the ghrelin gets surgically removed in a sleeve.
Yeah.
And even with a sleeve, you see GLP-1 activation. Why? Because the mechanical crushing function of the stomach as a skinny little banana now isn't there anymore. So the food will pass through the stomach in a more whole state, and the intestinal enzymes that break it down can't access all the nooks and crannies because it's still sort of stuck together. Yeah. So it will make its way farther down and stimulate those L cells in the end of the intestine to release GLP-1. So it's really like band, sleeve, and then the bypass operations in terms of weight loss, resolution of diabetes that you see.
All right. So see, Kim,
That's
you were
real technical.
It was you really didn't have the tools, Kim. Yeah. It's true. Yeah.
That's fascinating. Yeah.
So we put ourselves out of business, basically.
But like, here's the thing. And that's one of my questions. Here's the thing. There are some people, we have friends that were 600 and 700 pounds when they started in this community. Mm-hmm. And they have done a combination of GLP-1 treatments, either before and then surgery and then after, or surgery and then lost the weight and then added GLP-1s. Like, it seems like this whole idea of possible combined therapy is something that's becoming more commonplace. Like, what do you think about that?
Absolutely. Like if you're a bariatric surgeon that's not utilizing these medications, then you are way behind the times. It doesn't make sense for me to operate on someone who's 400 pounds and have such a high complication rate when operating on them at 320 would make surgery easier for me technically, make recovery easier for them in terms of getting out of bed, getting active, and things like that. The liver is going to be smaller, which I have to move out of the way to get to the stomach. So to lower operative risk, it makes perfect sense to utilize these medications. And then to prevent regain, which is a big Achilles heel of a lot of surgeries and a lot of patients who undergo surgery, these medications can be very effective to sort of putting patients back into that early post-surgical phase where it was so easy, the weight just came off. They experience that again because those hormones, spikes are replicated again. That high GLP-1 they had at the time, right after their surgery, over time fades, and we become accommodated, to certain signaling. And the introduction of the medication, years after surgery can take someone's brain right back to that sensation and that experience of quieted food noise and increased fullness that helps them lose weight.
Yeah, I remember one time I know what it was. Kat goes, so it all comes down to hormones. And you go, no, it all comes down to the brain.
Yeah.
I was like, yes.
We remember like everything you say, Dr. Rosen. So
I'm telling you that episode. I am so glad I named it that. I was like, because people watch.
It is all in the brain.
Yeah. Food noise is very interesting. Very interesting that people talk about, having that quieted for the first time is such an aha moment.
Yeah. Bizarre.
Yeah, that was my experience. It's like just as much as my ADHD medicine silenced the noise in my brain, the GLP-1 med silenced the food noise in my brain that I didn't even realize was there until it was quiet. And I was like,
right.
Wait, do people live like this?
Yes.
Like the same experience.
If you grew up next to the L train, I don't know if anyone is old enough to even know what an L train is, but if you grew up next to elevated train your whole life, and then that thing stopped running, all of a sudden you'd be like, oh my God, it's so quiet. Like you never knew that noise wasn't supposed to be there because it had never not been there.
Totally. I do remember go ahead, Kyle.
I'm sorry. I explain to people too on my lives and stuff. They say, well, I don't have ADHD and I don't know what food noise is. Like, how do you explain that? And I tell them, I was like, okay, next best opportunity is you're sitting in an airport and you put in AirPods and you turn on the noise canceling mode and it all gets quiet. That is also an example of how, and people they're like, are you exaggerating? I'm like, no, literally no. No, it is. It gets so quiet in my brain. I'm like,
I literally thought I had a stroke. It was very similar. And I moved up kind of slow, and then I was like, here I am, Kim. What you done now? Took another diet pill. Now you're the next diet thing. Done broke yourself. And I went, oh shit, I can hear myself talk. I was like, what just happened? You know what I mean? It is. And I remember saying to myself, this was literally when I knew I was going to launch the podcast because I knew it would help people. Right. I said to myself, are we going to squander this opportunity or are we going to do everything we can? And I said, I'm going to do everything I can. And I didn't just mean for me, I meant for as many as I possibly could because I wanted everybody to understand it is not their fault. That to be able to heal, one, your relationship with food, and two, your relationship with yourself, that is a gift. And everybody deserves that. Everybody deserves
that's heavy, no pun intended.
No pun intended.
No, I still get a little breakthrough. I call it breakthrough because I talked to Dr. Joy about this too. Yeah. But I think it's. I also take other medications to stop.
I will also say that
but it's still kind of. I have, therapist and group, coping mechanisms. So they do work in sync. So sometimes if anybody out there is like, hey, this is not fair, I still experience weird cravings or noises. It happens, but you're still so much stronger than without them. So
yes.
Yeah. I see a dietitian.
That's good. Go ahead. Yeah. Go ahead,
I see a dietitian and I also see a therapist. I've been seeing a therapist for years. I think every human in the world needs to see a therapist. every single person needs somebody to be able to talk through and like verbally work through life, your history, experiences with somebody who is trained to help you walk through that versus like just a friend or family member. But anyway, people ask me all the time, they're like, how do you feel about like your relationship with food? I'm like, well, I'm working on that in therapy and with my dietitian. And between the two of them, like I've never felt so comfortable in this journey because we're approaching it from medicine, knowledge, and therapy. Like all of that together is equaling a really successful experience that I always also tell people. They're like, well, if you only cut out this or you only did this, like you'd lose weight faster. I was like, wait, hold up. The goal is not speedy weight loss. I want sustainable life change. I want this to be the last time that I lose this weight. It is. I'm so confident in that, but I've never been confident in that before. And so I am thankful for the like multi-directional approach to this, but also just encouraging people, like the goal is not speed, it's sustainable. And so you have to do what allows you to still be able to experience life and be able to enjoy like trips and stuff. Like I just went to Nashville, which I didn't take a ton of food with me. I took like my little breakfast shake or whatever, but like we ate out every meal and I came home and I still lost weight because I made healthy decisions while we were at the restaurants, but I also still got to enjoy myself and have me a hot honey chicken sandwich in Nashville. Like the staple.
Hot chicken.
Yeah, I had to. Of course. But there's also
like everything in moderation. That's what people in small bodies been yelling at us forever, right? And we were like, I literally can't do that. Like because of all those reasons Dr. Rosen just described is not possible. And then when I fail to have everything in moderation, I beat myself up and talk bad to myself, right?
I know you got to live, and you got to take advantage of the tech. You know, it's your responsibility to live your healthiest life. And if there are things out there like therapy, like nutritional education, like GLP-1 medications or surgery that can help you get there, you know, that's your responsibility to take the ownership and utilize all these great things that are out there. No one gets a medal for white knuckling it and failing, you know, but like if you take advantage of all of this access and education on social media, you know, dramatic and magical things can happen.
Yeah. So Callie, you bring up a really great point because we know this medication because we've been around the bend, we've studied it, we've learned from Dr. Rosen and so many others. The concept of learning about this medication and people just wanting to get on it as quickly as possible is that people think it's a quick fix. And that's why Kim does her podcast. We're all trying to learn. And I love that you're able to share that aspect of being able to go on your vacation and still partake in what other people would consider real normal life. Now we're able to. And that's one of the things that when people come on this medication, and Dr. Rosen, you can speak to this, is people have this mindset of, let me get on this dose and let me get up to the highest dose as quick as possible because people equate higher dose, more weight loss versus let me take it slow and low dose so that way I don't eventually cap out on this medication. Like from the personal perspective right now, I'm taking a break from the medication. So I feel like my body might need a little bit of a reset to resume the medication. So the main question that I think is important for people either in this journey or starting this journey is, does the GLP-1 ever actually stop working?
Yeah, how scary, right? So I think that our bodies are programmed to become accommodated to something over time. And like I talked to you about, if there's a constant noise, over time, you don't hear it the same way. You tune it out. And your brain is made to tune out something that's there for a long time at a certain level chemically because the receptors become downregulated. If you always have the same high level of something for a long period of time, your body doesn't need a lot of receptors out there. The receptors that you have will be filled and your body knows that the medication is there. And so what we see with people on GLP-1 medications is you will see the highest weight loss typically in the beginning when they start a certain dose, And then that weight loss over time becomes less and less. And at some point, the weight loss stops, and you can even see weight gain on a given GLP-1 dose. You talk about capping out. So I see some clinicians who will put people on an increase every month, regardless of the weight loss. And that makes me crazy, because then those patients come to me and they've lost a lot of weight, but they have nowhere left to go. It's like a ladder and you're standing at the top rung and you have nowhere to go. And what I like to do is I like for people to lose weight at an appropriate rate. I don't mind if they lose weight fast in the beginning, but I won't push them up until they're not losing adequate weight on a given dose. So as long as someone's losing a pound a week, for me, that's fine. And even if it's not a pound a week, we'll have a discussion and say, like, how do you feel on it? Do you feel like it's still working? Is it giving you what you need? Maybe you had a vacation and didn't lose weight that month, that contributed. Maybe you have stressors and you're not working out. And, if you put in a little, if you feel like putting in a little more effort in this next month will lead to a successful month, I want to give a patient that chance, and often they surprise themselves and they do have, an increase in the weight loss the following month, despite staying on the same dose. So I always want to keep a patient on a medication dose as long as it's working. And then that will help. By the time they get up, they've lost so much more weight on that climb than you would if you just rapidly put someone up. Because until the next better medication comes out, when you cap out at 15 of Mounjaro or zepbound, you're not left with a lot of clinical options. We can throw oral adjuncts at it, like naltrexone, like bupropion, to try and squeeze out a little more. But at the same time, I want to let people know not gaining is winning, and just because you're not losing anymore doesn't mean you're not doing a good job.
Right. Or it's not working.
Yeah, right. Or it's not working. Like, you're sitting on an 80-pound weight loss. You know how hard your body's trying to work to put that weight back on?
Yeah, that's such a good point. Can you explain a little bit more there about that? Because I know since you've been on the show, we've had doctors come on and talk about the set weight theory, and people ask me about it all the time. And I just tell them, Google the set weight theory. But is that sort of the idea behind that with people with obesity?
Yeah.
It's trying to regain why,
Right. The body doesn't know what era it's in, right? Biologically, 1,000 years is a blink of an eye. And 1,000 years ago, food scarcity was the norm. Food instability was the norm. And you needed to have, a harvest in the fall so that you could get heavier, because in the winter, the food was going to dry up. The crops are gone. We didn't have refrigeration. The animals hide. You're just going to have a massive calorie deficit in the winter. So there's always this sort of up and down that comes, and heavy people who are going to last the winter longer because they're better at retaining calories. They're hungrier. They don't get full as fast from firsts, so they can eat more for seconds. And these are all biological programming. This isn't gluttony. This isn't, an inability to control yourself. This is biological programming. And those people would lose weight, and there was never this period where the food would always be there. But now the food is always there, right? It's just a DoorDash away, and there's no famine that's ever going to come, because our technology has gotten to the point where we can eliminate food scarcity to anyone in a developed country for the most part. So our weight just sort of keeps going up, but our body doesn't know that a famine isn't around the corner. Right. Our biological programming doesn't work on logic. It works on genetic programming that was refined over 1,000,000 years. 1,000 years is nothing. And so the heavier you get, your body's good, we're prepared. We're ready for the famine that's never coming. And it doesn't recognize that the chronic diseases that obesity brings with it is actually shortening lifespan. That's just not the way the body works. So as you go up, your body protects that new set point. That new set point becomes where the body wants to get back to, because that's when it was at its most insured or most prepared for a catastrophe. And so it's very hard to, just because you were 130 when you were 20 years old, if you're 160 when you're 40 years old and you've had a couple kids, the notion of getting to 130 and staying there on your own is probably not going to happen because of the set point theory.
Fascinating. Everybody, anytime you send us a message and say, I'm not losing weight anymore, I'm at a stall, I've lost 80 pounds, I want you to listen to that clip. Okay. Yeah. Yes. Because that is so important. You live, regardless, your body is still diseased. It's just not, it's not, you know,
you talk, Callie, you talk about, you're going to do it right. You know, you're going to do it right. And you're going to do it once. And I wish that will be the case for you. But I have enough experience with this disease to know that, you know, challenges will rise and your body's programming will want to exert itself. And you may find yourself needing to revisit all of those great things that you're learning now on your current journy.
Yeah, for sure. I mean, going back to the doing everything you can piece, Callie, like, I feel like I didn't do that. I in the beginning, I didn't know what the hell I was doing. Girl.
She's like, she's such a sweet babe, isn't she? Like us.
I'm so true. But she's doing all the things that, like, I didn't learn until like a year in,
incredible.
Right?
No,
it's so cool.
Amazing.
Like,
so inspiring.
Like, those are the things
Totally
that can for sure set you up to success. And then I think it's just a matter about, like, what's that next thing, right? Like, because I know that this is a chronic disease and we want people to accept it as that, because it is, right?
Yeah.
But it's like, ultimately, at some point, your body's going to fight you again, right? And then it's like, okay, so what's the tool now? I'm using these tools that I can control. What's the tool that we can have with my doctor? I've got the food. I know how to eat, right? I know how to move, right? What do I do now? What am I doing with my brain fighting me? Is there a different kind of medicine? Is there a combined therapy? Is there surgery? Like, all of these different things. Like, that's why we need options. Because up until now, it's really, no offense, Dr. Rosen, that's kind of all it's been, is surgery, right? Like, it still is considered the most effective thing in terms of the data, you know? Yeah.
Well, yeah, I was considering that too. Like, because beforehand, you know, I was doing all the things except binging.
Yeah.
You know, I could white knuckle a few, like, you know, good 5-6 days, and then I can't take it anymore. And so, but that's what this medication has done. It's taken, and what a difference it's made.
The relief of that white knuckling thing, that's big. Did you see Jillian Michaels recently, by the way? I know she's your favorite on News Nation. I don't know if you saw it, because I'm going to spill some tea real quick with the doc. Listen, so Jillian Michaels goes on News Nation and she's all like, exercise. You, if you're just going to eat less, you don't need to be on this and blah, 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 right? All the things.
You know, so patronizing. You don't live in this head.
Luckily, though, there was an obesity doctor on the show, right? And not till the end, but she was like, no. Because one of the guy was like, well, hey, listen, like, and this part I thought was like key, and I'm hoping this conversation's starting to like get better. But he said, can it be that sick people need the medicine and also that the food is straight trash? Like, can't these two things be true together?
Totally.
And nobody said anything. I wish you had been on the show, because you would have been like, yeah. Like, why?
Also, it's like she gets paid to exercise. You know, the notion that Callie was told to exercise for 90 minutes a day. It's like, what reality is that person living in?
Right.
Like, not only are we not necessarily programmed to love exercise, and it's a challenge, but who has 90 minutes a day? Plus, talk about, what do they say? What's the saying? Eat less, move more. Is that?
Yes.
You know? Yeah. But what they don't understand is it's like, move more, eat more.
Yeah.
So
because your body, when you burn calories, what do you think your brain tells your body to do? Like, it will make you hungrier.
Made me so much hungrier.
You will eat more calories over the ensuing 3 or 4 meals to replace calories burnt through exercise. The data is unequivocal that exercise is not a weight loss treatment. Like people say you make your abs in the kitchen.
Yeah.
That's true.
It's true.
Because exercise does not achieve weight loss, because whatever calories you burn, your body will be driven to replace, unless you have a chemical that you're injecting to stop your hunger, or you've had surgery and your stomach is now this restricted tube that cannot accommodate the number of calories your brain wants you to replace.
Yeah. So true. Yeah. And one of the doctors did jump in, and I think it's the first time that I've ever.
I agree.
I think it's the first time I've ever heard a doctor, like, on anything kind of mainstream, I mean, close, where she was like, here's the thing. What you don't get is someone that's been overweight for a really long time. They have severe insulin resistance. And I was like, hallelujah. She said it, right? Which goes back to all that stuff you were saying in the beginning, right?
And she also said exercise makes people who have insulin resistance even more hungry as well. So
right. And leptin, leptin, your fat cells produce leptin, and leptin is the body's mechanism to try and control your weight. It does have a way to try and kind of keep you in a narrow range. 3,500 calories is 1 pound. And with the amount of calories that we eat in a year, to only gain 5 pounds or 10 pounds when you're consuming hundreds of thousands or millions of calories, shows that the body's staying in like a 99%, rate of taking in what it burns. So leptin is something that works with ghrelin and GLP-1 to sort of limit the intake, but people who have insulin resistance have leptin resistance. Just like I talked about that noise. If you have a lot of obesity, if you're carrying a lot of fat mass, you're always having a high leptin level circulating through your blood. And so your brain tunes it out after a while, because it's used to that weight being high, then that weight coming down in the winter, in the famine. But because it never varies and it's always high, your brain has just completely tuned it out. So leptin resistance goes hand in hand with insulin resistance.
Yeah. See, it's so complicated. People like that need to quit being like, it's just the food. It's just eat less. It's just mood. Like, stop. Like, go look at the science. And she's like, but studies say exercise. And I'm like, I'm just going to poke you in your eyes. Like, I can't even, this woman. Like, stop.
I just love it when, I think it was either the anchor or the doctor clapped back at her and said, but you would lose money if people did GLP.
And then she was like, I could be like Weight Watchers. I
could go, Dr. Rosen, you have to go back and watch it.
She goes, I want to be on the right side of history. I'm not kidding. It was a quote. I was like, my brain.
She did say that. Yeah.
I mean, what's so ironic?
I know.
It's so ironic because she's so obviously on the wrong side of history.
Obviously. Like, but that's the thing, is some personalities, right, will never, ever, ever say, you know what? I was wrong for 30, 40 years. No, like some personalities will never go, you know what? Everything I ever did to shame people into starving themselves on The Biggest Loser and tell themselves they were pieces of crap and all these different things that she did. And there is video evidence, lady, right? All those things that she did to hurt their soul, right? All those things. She would have to be like, I was wrong.
She needs a kid with obesity.
Right? Clearly, like, then she'd understand. We had the petty pals, which are the, they're the pediatricians. One of them has a child that deals more with this versus the other. And it's just, they were just dealt 2 different genetic hands, like and then one of the doctors also, she struggles with obesity. And she's like, I eat less than my friends over there that eat a ton. They're just people that are more metabolically efficient. Right. And if we can believe that somebody in a small body that can eat like a trash panda that never gains any weight, right, is something that makes sense and we can accept it and many times like revere them, right, then we should be able to accept that the exact opposite is also true. And I just want people to get there. So we're going to work on that here. Now, PMAC had a question and I keep interrupting her. So,
so it's actually a twofold and it's a shameless plug. One, You mentioned being on the wrong side of history, and I completely agree that there is a line being drawn in that sand. If anybody doesn't know, there is a Senate hearing coming up towards the end of this month, in which Bernie Sanders subpoenaed Novo Nordisk CEO, if I'm correct. Yeah. Yes. So he's going to have to appear, and there's going to be a lot of discussion about why does the medication cost so much, insurance, all of those things. Now, Dr. Rosen, if I'm not mistaken, one of the things that I learned about you throughout the course of this process is you are very open as a bariatric surgeon when it comes to giving people those options of, let's explore GLP, or if they're just like staunch, I don't want to do GLP, then you're going to go over the bariatric options that are available. That is something as a lap band person and now GLP-1, I wish my bariatric surgeon here locally would have even had that discussion with me, because I got stories for you and we can talk offline. You're going to know exactly who I'm talking about when I tell you who it is.
I don't
but the question, but the question is have you in your field seen a difference of insurance companies wanting to do a conjunction of the therapies, both the GLP-1s and the surgery, or are you getting pushback from insurance companies one way or the other?
Yeah, it's a good question. I think it's evolving. You know, as we're speaking, it's changing all the time. I think in the beginning we were seeing a lot of insurance companies resistant to approving meds, and that was the biggest thing. And I'm seeing a softening of that, thankfully, especially as the companies have released obesity-specific versions of these GLP-1s. Now we don't have to have people who are being prescribed Mounjaro, who are non-diabetic, and then being approved because they don't have the diagnosis to support the indication, the indication to support the medication prescription. So I'm seeing a bit of a softening when it comes to insurance approving the meds for obesity, which is a long time coming. I'm not seeing them encouraging us to do combo therapy. Thank God, for the most part, they leave us to make whatever clinical decisions we feel are right. They might then deny us the clinical decision we've made as not medically necessary, but at least they're not pushing things on us proactively. One thing that they've said will happen, because these medications are currently expensive, including for the insurance companies, like they have to pay a lot to Novo Nordisk and Eli Lilly for these meds. And these are medications that for the majority of obese people will be a lifetime use medication. They are seeing these costs projecting out for decades as being significant, whereas the cost of bariatric surgery is a one-time sort of thing. And so what I'm hoping to see, and I haven't seen it yet a ton, but I have seen it a little bit, is the stringent requirements in order to get people approved for bariatric surgery, which are steeped in obesity bias, where you need to have 6 months of visit, where you need a psychiatrist to approve it, but you don't need a psychiatrist to approve a breast reduction, where you have all these roadblocks to get surgery. Those are starting to be removed by the insurance company to incentivize physicians or surgeons to encourage people to get surgery, because it can happen without this massive roadblock, which results in like 50% of the people falling off and never getting their procedure. So I think that the insurance companies are making a calculation and determining that the long-term cost may be less if they get bariatric surgery than if they have to have a lifetime of these medications. Now, of course, people will have to factor in that 50% of the people who get bariatric surgery are going to go back on meds for weight gain down the road. So there's no perfect answer for this, but you can bet that the insurance companies are going to look at the numbers and the dollars and pick whatever saves them the most money for their shareholders, not necessarily what's in the best interest of the patients. So
yeah, no, I would kind of think of too, with as many of us that had lap band, how many of those patients have now had to do revisions?
Oh,
and so
by far the majority.
Yeah.
I mean, it's been cliche for 8 years, 5 to 8 years. I take out more lap bands than I put in. I mean, if there are surgeons putting in lap bands in more than 5% of their patients, they're not following the latest data and the science in terms of providing their patients with the best care, because it's so fraught with long-term complications. It provides the least weight loss of all the surgeries. It's like someone really has to twist my arm for me to put a lap band in them. They have to tell me, like, the only thing I will accept is a lap band for me to put in a lap band. It's nothing I ever suggest. The balloons, same thing, because the balloons won't give you nearly as much weight in 6 months as GLP-1 medications will, and it will be at 50% or less of a cost, even if you're paying out of pocket for compounds. So, putting in a balloon does not benefit a patient in any circumstance, because when it comes out, their anatomy is exactly the same, their hormones are exactly the same, weight gain is predictable, and they're $9,000 out.
And I have to say that I truly, truly appreciate your approach to not just being so one-sided within a bariatric surgery situation, because a little bit of my personal experience, when I got to the point to where I had to make a decision, I went back into my doctor. They were going to do a fill, and then they were like, nope, we're not going to do a fill. And there was no discussion whatsoever about GLP-1 medications. And that is where, of course, the popularity of the medications has grown, the information has grown, and I'm hoping that more doctors are getting more on board with it. But I was left to my own defenses. Had it not been for me getting on TikTok and start looking up this information, I would have maybe still been in the same position I was in last year.
Where do you live?
I'm in Dallas.
Okay. I know who you're
Okay. I figured you probably would.
We won't say any names.
I think I have a really good wrap-up question, but I was going to let Kat ask it because she wrote it.
Oh, you're funny. Well, yeah, it's a good segue. Speaking of GLP-1 therapies, we've heard Novo Nordisk. Is it not Novo, or is it the insurance companies are trying to get money back for?
Oh yeah,
being Ozempic off label.
No, this was Anthem.
It was Anthem. That's it.
Mm-hmm. Yeah.
Educate me. I'm listening. Educate.
Oh yeah, you haven't heard?
Ooh.
How have you not heard, Dr. Rosen? Jeez, don't you watch my TikToks? Jeez, listen.
I told you I've been underground.
I know. Listen, sometimes it's necessary. I went underground for a month. Yeah, I had to.
So what's
just like the Ninja Turtles?
So the article that came out was on Bloomberg, and it said specifically that Anthem was trying to come after doctors who had written specifically Ozempic off-label for weight loss. And the doctors are like, wait a minute. Like, there's nothing illegal about that. There's nothing wrong.
What does it mean to go after?
Asking for millions of dollars to be returned.
Out of the doctor's pocket?
The doctors.
They're like,
we didn't take the money. We just it.
In what scenario is the doctor making money from the prescription? Like,
they want someone's money, right?
The doctor is seeing the patient. The doctor is, giving their best advice. The doctor is delivering clinical care, which may include a prescription in their estimation that would benefit this patient, even if it's an off-label application of that medication. But they are not earning money from writing that prescription. That would be illegal.
Yeah.
And even if, they were doing something unethical, which off-label prescribing of a incredibly successful medication for obesity, prior to the application of a diagnosed specific use for that medication is certainly not unethical. But even if a doctor is doing something unethical, then they should be investigated. They can have sanctions, license suspensions, but you can't expect to claw back money from doctors who are out there trying to advocate and do right by their patients.
Right.
So I can't imagine that actually happen. Yeah. I could imagine that it's a scare tactic.
Yes.
That the insurance companies are putting out there, just like the drug companies put out scare tactics about using compound medications to preserve their market share. The insurance companies who are paying for these medications are putting out scare tactics to decrease the number of prescriptions that are being written for for these medications while there's a shortage. I can imagine that. I can't imagine it ever went through. And at the end of the day, we have medical licenses in order to provide care to our patients in the best way we can. And if there's a medication that has been determined to provide benefit, even though it wasn't developed for that purpose or reimbursed for that purpose, we are only doing our jobs by prescribing it.
Absolutely. And how common is that for doctors to write something off-label, for example, right? So we know Ozempic and Wegovy are the same daggum thing, right? We know Mounjaro and zepbound are the same thing. We know Victoza and Saxenda are the same thing, right? So how common is it for, I mean, and we know, like, I do remember like learning like 25% of insurance companies, that's it, are covering the obesity versions. So if insurance company isn't requiring a specific diagnosis or PA, why can't you prescribe something off-label that you know scientifically with data will help your patient?
Right.
You know?
It's like Wellbutrin is a medication for anxiety and depression, but it's been shown to cause weight loss. It's like naltrexone is a medication used to prevent opioid abuse, but they've also found that because its impact on cravings, it can be used for smoking cessation or for obesity. You know, these medications,
same thing, right? With like BED.
Right, exactly. So it's not an indication that the drug was developed to treat, but through data and studies, it's been proven to help other indications. You know, it happens all the time. And it just shows that a doctor is paying attention to the studies and to the data that's out there because they want to give their patients every opportunity they can to impact their disease states. Yeah. So it happens all the time. And it's a mark of a good doctor if they're willing to go beyond these rigid determinations for a medicine, you know, and PMAC, you talk about how your doctor won't prescribe these medications. Maybe it's because they weren't trained, you know, when they were back in med school in the Stone Age to write for these medications because they're not comfortable with it. Well, then get comfortable with it or refer the patient to a doctor who is comfortable with it.
GLP-1 evangelist.
That's what he said.
Get comfortable or refer to a specialist. Had enough of these yahoos.
Preach it.
Enough of this foolishness.
Optum needs to get on the right page of history also.
All of them do. It's insanity. Like
karma's coming for you.
I'm telling you, like this whole Jillian Michaels thing and like pairing up with this guy who's like clearly a politician because he cannot answer a question to save his life. They're like, he's like, but I'm asking you, like the reporter on that News Nation was like, I'm asking you.
Can't they both be great?
Can't these both be true? And he's like, that you're giving me a complicated, loaded question. He's like, no, let me repeat it. It's really simple. Like it's, you know, but nobody would admit it because he wanted to like push the agenda. And now she's partnering with him. Oh, it's the food, you know? And it's just ridiculous. And like he said that it says on the box, this is a lifetime medication. No, it doesn't. Like you know what I'm saying? Like it's a lifetime disease, unfortunately. But then there's a lot of stuff going around like, oh, you're on this for life. Like it's like it's fucking crack. Sorry, I'm just saying it. Like
that's between you and your doctor.
Yes, that is a decision for you to make with your doctor because the insurance company should not be trying to decide, right, what you need for medical care. They don't have a license, you know? So that's why we need our doctors.
They have a license to profit.
Yeah, they do. Clearly. Bunch of garbage. Well, the plus sides is going to go to the hearing in DC. And we have shirts. We have shirts that say make GLP-1s affordable and have our logo and then a little QR code that you can scan and go to our website that I made in Canva because I don't know what I'm doing. So, but we're going to go and we're going to stream and we're going to be there. And we're going to get comments. And we're going to have the community feel like they're a part of this. Like, because ultimately, if we're quiet, right, which is what many of us in a big body have felt like we had to be, right? Then people are going to make decisions without us about our futures, right? So we have to be present. And so we're going to go and we're going to be there and we'll tell you how it goes. So stay tuned. Yay.
I might come too. Now I'm getting gassed up. I'm getting gassed up.
Yeah, you're not that far. Will you come?
You're what? It's like 4 hours, right? A 4-hour drive.
Your appointments.
I could do it.
You can just drive down the street.
I'll just be there with a megaphone.
Bernie Sanders, right?
On the corner.
Yes. Bernie Sanders has, I mean, it's everybody, right? But it's a Senate hearing, and he's having, they're really trying to negotiate with them to be able to get these things on Medicare for the Treat and Reduce Obesity Act, right? So they're trying to make this. So it's next week, and it's on Tuesday, and it's like 10 o'clock in the morning. So it's in DC, and the CEO of Novo Nordisk is going to be there. So that's what it is.
Cool.
Yep.
Be there, people. Advocate.
Yep. Yes, come join me if you're into it. Like, we'll post this early so people will come, or we'll make.
Yeah, I'd be there in a heartbeat if I wasn't going to be in LA for a conference on the other side of the country. I know, because I love me some DC advocacy.
Listen,
I think I've been up there 10 times in the last year.
I don't follow you anywhere else, and I need to know everywhere to follow you.
Yeah.
Okay. And
we need people to push it out. I will not unfortunately be able to make it, but I will be pushing all of.
Yeah, you'll be here. You'll be here getting everybody on board. We'll do lives,
and so
get people riled up. Let's get people riled up.
I told Kim I want her to sit in the back, just like right behind the person who's being interviewed, and I just wanted to hold up a sign that says, "I matter," something to that effect. Be like, why does it cost me this much? Just be in every single camera's like purview.
Yes.
So
I'll find a way. I'll be in a box.
Little story off that really quickly. It's totally off topic, but I was in DC with TikTok for the Senate hearing last year, and I was sitting right behind Shochu, the CEO. My dad was also in view, and so we were on the CNN cameras or the C-SPAN cameras for 5 hours, and I had to keep a straight face. Yep, I'll tell you. I
feel such an imposter. I don't know what the hell I'm doing. So
it's a fun when you can get involved in the government and get involved in advocating for our lives and for the things that matter to you. It's very empowering. I've learned a lot over the last year and a half.
That's awesome. Well, anything you want to share, I'd love to hear. Cause like, honestly, this is the first time, like for anything, it's just like, my husband was the one that said, he was like, look, ultimately we're doing things that are helping people. And that's great. He goes, but a lot of those people are never going to get up and do this thing. And we need to do that for them. It was his idea. He was like, we need to be there. And I was like, okay, let's go, so we're going to go. I'm taking my kid too. How long do you think this is going to be? Cause he's on stuff, but it is cool. I will tell you something, because I've spent so much time doing this podcast and advocating over the past 18 months, and it's pulled me away from my family a lot. It really, really has. And when I was with them, I was just thinking about all the things because I was getting so passionate about it, and it was really hard to be present. And my son went to school, and he went and said to his teacher, I want to get more apples in the cafeteria because I think we should have more apples, because he likes apples. He's autistic. So he really loves apples. And he was like, we should have them. It should be a thing. Like, we should get them. So he went and created a petition and got my autistic child and went and got all these children to sign it. And the teacher sends me a message and tells me this, right? And then as soon as he got in the car, I figured it was like for a project or something, because I didn't really know what was going on. And he said, no, Mama, it's like you told me, you've got to teach your kids to advocate. Right? So it's the ripple. All of this is the ripple. And everyone listening right now that shows up or doesn't show up or comments on this post or shares it out, that's is community. That is advocacy. Every single person that contributes in any way is a part of the movement if it affects you. And if you stand up in some way, in some form, and say it's not okay and how it should be. And that's what we're trying to do. Now, I don't know what the hell I'm doing, but I'm going to show up and try. I'm just a marketer, from Georgia. I don't know, but we're going to try. You never know.
You got to start some good trouble.
We're trying. Yeah. Well, I hope you come. Message me.
We'll see.
Okay.
If I'm not there in person, I'm there in spirit.
Of course. Yeah. And that's okay, right? That's okay. All right. Well, this has been a lovely episode. I know we went about over 15 minutes, but thank you for staying. I appreciate it so much. I think we covered some good ground. Yeah.
So glad to be here. So glad to see everyone and meet everyone.
Oh,
always great to talk to the Dr. Rosen.
Dr. Rosen. And Callie, thank you so much for contributing.
Thank you, Callie.
And thank you so much, PMAC/Priscilla, for coming and being our guest host this evening. We appreciate your contribution so much and your perspective, because it's important. Okay. All right, everybody. Peace out. We'll see you in 2 weeks. Actually, we'll see you in DC if you're watching. Okay. Hasta la pasta.
Goodbye. Good evening.
Are you ready to transform your approach to weight management? Introducing Mochi Health, a revolutionary telehealth platform connecting you with board-certified doctors and dietitians from the comfort of your home. Their holistic approach includes personalized nutrition plans and FDA-approved GLP-1 medications like Ozempic, delivered right to your door. At Mochi Health, they believe in affordable, accessible care for everyone, regardless of insurance coverage. No more blame or shame, just support from real doctors and dietitians who listen. Visit Join Mochi today to start your journey to a healthier you. Use code PLUSSIDES with a Z to receive $40 off your first consultation. That's joinmochi.com with code PLUSSIDES. Mochi Health, where your well-being comes first. Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m., and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again. And the hot flashes are gone, which is, geez, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through the same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need. Today's episode is brought to you by Ro, a telehealth platform that's changing the game of GLP-1 access. What sets Ro apart? Ro understands the challenges of navigating insurance hurdles and the skyrocketing prices of GLP-1 medications. That's why they specialize in getting insurance approvals for GLP-1s. And if insurance is a barrier, they go a step further by prescribing brand name zepbound vials for prices close to those of compound GLP-1s. With Ro, you're not just getting a prescription, you're getting a partner in your journey that's helping you access affordable treatment and guiding you every step of the way. Whether it's insurance approvals or cost-effective alternatives, Ro is here to make sure that you get the medication you need. Visit ro.co/plussides with a Z today to see how they can help you take control of your weight management journey with affordable, accessible care. That's ro.co/plussides with a Z, making healthcare work for you. Check out the link in our show notes for more details. Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.